Hello students, how are you? I hope you're fine during this pandemic period, and welcome to our channel Combat 2020 for online teaching tool for students of MBBS. Today we'll be covering an important topic which may not be important from medical point of view, but from the social point of view it is of much more importance. And the importance you will only know when some of us will fall in or suffer from the disease. By quoting Stephen Hawking, that however difficult life may be, there is always something you can do and succeed at it. It matters that you don't give up. And why this quote is put, you will come to know at the end of the presentation. I hope you know this guy. Who is he? I'll be asking you the questions by the end of the PPT, or more importantly, during the examination assessment part when I'll be putting that. And be ready with your answers. These are more, the stories are very important. They are in introduction. Let us start with today's class. Today's class is about persons with disabilities differently abled. And I will be asking you most important question in the assessment. So I hope you will be ready for that. And the assessment will be based on questions which are not found in the book. So we'll be trying to define a disability, the problem statement, the specific needs of the people. What are Let us start with the definition of disability. According to the International Classification of Functioning, adopted as a conceptual framework of this report, defines disability as an umbrella term for impairments, activation limitations, and participation restrictions. So, disability is not having losing a limb, which we always have in common parlance of disability, which is taught or ingrained in our mind. The physical disability, disability is also activity limitations or participation restrictions. Disability refers to the negative aspect of interaction between individuals with a health condition. In the first slide, when I show you, that was a photo of Stephen Hawking, and if most of you know who is Stephen Hawking, you know that Stephen Hawking has suffered from motor neuron disease, which means death after 20 or 30 years of age. But Stephen Hawking survived, and he gave us one of the most beautiful theories of universe. So, what does the definition of disability mean in this paragraph? Is a negative aspect of interaction between individuals and his health condition will be termed as a disability. That means if an individual is not able to communicate with his environmental factors because of his limitation, then that turns out to be a disability. Look at the problem statement of the various surveys. So we have two surveys: the World Health Survey for more than 14 years for global health burden of disease for children, and global burden of disease for more than 14 years. The WHO states that there are about a billion people, 15% of the world population, who face some form of disability, and between 110 million to 120 million who have difficulties in functioning. Just take a closer look at the surveys. We can find the 785 million people more than 14 years are disabled, of which 110 million are severe. We have severe disability. Looking at the less than 5 years children, 95 million all around the world are disabled, with 13 million severely disabled. The Global Burden of Disease report, which is one of the most authentic reports published, makes an estimate of 975 million of 19.4%. That is 20% of the world population is having some amount of disability, which is a very very dangerous estimate to know. And I will tell you why this 20% is coming, because according to us, physical disability is only the disability, but it is not. For example, if you are lost in jungle and if you do not have the skills of survival, you will be lost there. You are disabled. So not having a skill of doing something or interacting with the environment is a disability. I hope you are understanding the difference of disability in this case. The disability is not what is always seen, it is always in the mind or the perceptions of the person who sees the disability. So disability, how is disability measured? It is measured by disability adjusted life years. In India, we can see the most common age group affected by disability life years is 0 to 4 years of children, which 2 lakh life years lost. All by all causes, it is 58 lakh life years lost. Sorry, it is I lakh life life years lost. It is 2 lakhs in case of children, and on the contrary, from 60 to 69, the most common cause of disability in life years is neoplasms and and lymphomas and leukemias. But in children, the most common cause are congenital defects. Coming to the Indian definition of the disabilities as per as the Right of Persons with Disability Act 2016, and you should know this. The persons with disability means a person which has a physical, mental, intellectual, and a sensory impairment in interaction with barriers, hinders his full effective participation in the society equally with others. There is also a definition called as person with benchmark disability, which means a person with not less than 40% of specified disability. That's called benchmark disability. And this act is more important. You should know this act bit and pat. What are the types of disabilities? So there are 2.68 crores disabled people with disabilities in India, which contains 2.21% of the total population. uh, which are most common disabilities are in movement. In males, but the most common disability is in movement, but in females, the most common disability is in seeing. The population residing with disabilities according to rural urban pattern, you can see the most common people are residing with disabilities in rural area. That is why their inclusion becomes difficult, because services for disability are not available in rural areas. So disability turns out to be, for these people, disability turns out to be a step back in their life, which affects their livelihood. So what are the issues with disabled people? If people, because of inadequate policies and standards, disabled people do not have a voice in the governance of the country. They suffer from negative attitudes of the people who are staying around them. There is lack of provisions of services for disabled people. So if you look at before 2014, disabled people did not have any lines special line for disabled people. There were no special coaches in trains for disabled people. There were no special toilets for disabled people. Now, if you see, there is a paradigm shift, because the international community has recognized that disability in the mind. That is why the person should get an equal opportunity. That is why you have this physical constructions where differently able people are given reservations. They are not only that, they are also given special coaches for traveling. There are special concessions for disabled people to travel. They are recruited in government services. So there has been a paradigm shift after the law has come after 2016. Fourth will be problems with service delivery. Yes, inadequate funding to the disability program, lack of consultation and involvement, and lack of data and evidence. Yeah, so if we have data for 10 years before, so today is 2020, we are only citing on data of 2011, which would have collected in 2009 or 2010 end. So for the 10 years we do not know whether disability people have increased or it has decreased. Related issues of differently abled. So because of this, they have poorer health outcomes. They are not able to access health. They have low educational achievements, and because of these negative attitudes, lack of policies and standards, no reservation, they have low educational attitudes, which negatively affected their less economic participation. Because if they have less economic participation, there are higher rates of poverty, and people will also not employ them for doing manual labor because they are disabled. So there's an increased dependency. That leads to increased dependency, restricted participation, and they become a beast of burden on the other relatives. That is why people with disabled are not treated well by the relatives or other or the society. Paradigm shift in that we need to addressing the barriers and the inequalities. So we know that they have addressing barriers to healthcare, to rehabilitation. They need support and assistance services. They need an enabling environment. They need education and employment. So how can you do that? So for example, if you want to do an addressing barriers to healthcare, you need to have specific programs and services for people with disabilities. For addressing barriers to rehabilitation, you need to enable access to all mainstream systems and assets. Addressing barriers to support and assistance services is to improve the human resource and capabilities. So if I want tomorrow that I need people to train disabled people in doing a work. For example, if I have a person who has suffered from lepromatous leprosy with no involvement, I mean claw hand, I need people to train that person operating a machine. That is why capacity building is important under the national program. Creating enabling environments is involving people with disabilities. And so that we have disability groups, we have community based rehabilitation, where the community as a part take care of the person and helps the person to get rehabilitated. Address barriers to education, that can be happen after investing in special programs and services of the disabled. And lastly, addressing barriers to employment by adopting a national disability strategy and plan of action, as well as reserving some seats of for disabled for a specific jobs. I here you should always remember that here we we in the government service, if disabled people are recruited at all posts, so they may be also be recruited for post of IAS and IPS, mean IFS, where we have a lot of our officers. Even last year, there was a case which has happened where a woman has recruited for Indian Foreign Services. Okay, but the same cannot be told in private sector education, private sector, not about education, about the employment. In this case, uh, the problem becomes that they may get employed in menial jobs. Menial jobs means like working or driving a cart or even working for a liftman. Okay, so that attitude or the tendency has to be changed. We need to recruit people, disabled people, based on the education qualification, even for higher post. With that mindset needs to go off. So, what are the statutory provisions? Statutory provisions are those provisions which are backed by law. So, it is the constitution which backs the laws and the various policies which are formed by the constitution, by the state. Okay, so all of you should know that the constitution is something called a preamble, which guards equality of status and opportunity to each and every person in India. There is something called as the fundamental rights, which protects the fundamental rights of each and every person, so which are also available to the disabled people. In fact, in more importantly, they have a right to work, to education, and to public assistance in certain cases. And in the 11th schedule, they have right to social welfare, including welfare of the handicapped and mentally retarded. So the constitutions have made a lot of provisions, so not only taking care of the normal citizens but also of the disabled or the weaker sections of the society. The specific acts which are related to the person with disability are the Rehabilitation Council of India Act 1992, the National Trust for Welfare of Persons with Autism, Cerebral Palsy, Mental Retardation, Disability Act 1999. But what which is much more concerned with about us is this act. We should focus this on this, the Rights of Persons of with Disability Act 2016 passed by the Parliament. It's a comprehensive act which describes each and every uh, disability fully. So it describes what is a locomotor disability. If a person is not able to move, it's called a locomotor disability. So what is leprosy cured disability, cerebral palsy, dwarfism, muscular dystrophy, and most importantly, this is a new term which is added. The acid attack victims are also included in physical. Visual impairment, we know the definition of visual impairment after having the best correction, total absence of sight, or a visual acuity less than 3 by 16 or less than 10 by 20 in Snellen in the better eye, or limitation of field of vision subtending an angle of less than 10 degrees is visual impairment. In hearing impairment, a person having 70 decibel hearing loss in speech frequencies. Hard of hearing means a person having 60 to 70-degree hearing loss. And speech as language disability means a permanent disability arising out of conditions such as laryngectomy or aphasia affecting one or more components of speech and language. There is a new term which is also put in the law is the intellectual disability. It recognizes that intellectual disability is a part which is much more of we talk about the learning disorder. It has classified the intellectual disabilities into two parts: specific learning disabilities, which are perceptual disabilities, not able to comprehend, dyslexia, not to study, graphia, not able to see, calculation, dyscalculia, not able to calculate, dyspraxia, and developmental aphasia. Autism disorders of neurodevelopmental disorders are also included in intellectual disability. The mental behavior, the mental illness means a substantial disorder of thinking, mood, perception, orientation, memory, grossly impaired judgment, behavior, capacity is included. Disability arising out of the chronic neurological conditions, which may be multiple sclerosis, Parkinsonism, are also included as disability, and blood disorders of thalassemia and sickle cell disease are also included. And this is very important. This is what makes it the act much more enabling. It has not only it has shifted the focus from physical disability to an overarching habit of mental disability, and also a disability arising from loss of uh, loss of quality of life. A person can also suffer from multiple disabilities, so that is also recognized by the law. More than one of the specific disabilities, which include deaf blindness, which means a condition which person may have combination of hearing and visual impairments, or any other category as may be notified by the central government. That means if none of the above, thus the government can notify from time to time a new disability which can also be included into that. We have a national policy for persons with disability 2006, which has focused on prevention of disabilities and rehabilitative measures. The policy provides for the following. So when you are writing the answer, any answer in community medicine, you should always write like this. So prevention, the rehabilitation, capacity building, research, IEC, community participation. If you do not know anything, you all should write all these six terms. Prevention, if there is rehabilitation component in the disease, you write it. Capacity building is training of staff, research in the disease, information, education, communication for health awareness, and no program can run without community participation. So you should always, if you do not know anything, please write this. So you at least you get marks. Rehabilitative measures. There's physical rehabilitation, educational rehabilitation, and economic rehabilitation. So, physical rehabilitation will include early detection of disability, counseling and medical rehabilitation, use of assisted devices which are given free of cost like Jaipur Foot, and development of rehabilitation professionals for the specific. That's why uh, we have a specific specialty in for physical rehabilitation. Economic rehabilitation will include employment in government establishments, wage employment private sectors, and self-employment given under the Mudra scheme. The other provisions include provisions for women with disabilities, for children with disabilities, a barrier-free environment, the issue of death certificates which is given by the medical authority of the district, social security, promotion of NGOs and organizations, collection of regular information, research as I told you, sports, recreation and cultural life, and amendments to the existing act dealing with persons with disability. Of this, more important thing for us will be the promotion of NGOs. The NGOs form a link between persons with disability and the government. The government gives the NGOs funds so that they can trace based on them, but the fund is given based on the performance. If the NGO is performing and having a good track record, it is funds from the government for treating as well as in the persons with disability. But what's most important in this case is rehabilitation of people with disabilities. The rehabilitation strategies will include institutional based, community based, or outreach service. What is the medical model? The medical model emphasizes that patients should be treated in institutes rather than home, usually center outreach and a mobile camp approach. Service providers only concentrate on medical problems, prescribe occasional interventions, and consider medical rehabilitation is the only answer, and relationships of these people is only given. But in the medical and social model, which we have in community-based participation, the community and the persons with this person with disability are the major resource. The community is seen as an enabling force to the persons with disabilities, and the acceptance of the community is taken as an indicator that the person is doing well. The community can push the person to do well. So it's more democratic as principle makers, reflects right perspective rather than the charity. Rehabilitation takes place as a doorway of the PWD, and the social inclusion more important than medical rehabilitation. We have an early intervention, regular follow-up, and total rehabilitation. So this is what is done in community-based rehabilitation. There's self-care, there's ambulatory effect, communication, vocational guidance. Camps are organized from time to time to rural areas where community facility is not available, and efforts are on to integrate the community-based rehabilitation institutions to provide maximum reliable community to all parts of the country. What is the difference between institutional-based rehabilitation, community-based rehabilitation? You can see the location. Cities in community-based rehabilitation communities, decision makers are service providers. Here the decision makers are PWD and their family. Service providers are many professionals. They may be professionals of various specialties. CPR workers, here there are CPR workers and semi-professionals. Action is usually responsive. Here it is proactive approach. Identification is delayed and intervention is also delayed. Here the intervention and identification is early. The follow-up, we don't know. The follow-up, some people who are enthusiastic may come, some who are not, they may just fall back or stop it. But follow-up is guaranteed in community-based rehabilitation because of the pressure of the community to perform. Services far, they lose daily wages. That's why institutional based people will not come, but as services are provided at the doorstep. Complicated problems are easy to tackle here. Here in community medicine, in community based rehabilitation, they are very difficult. Cost of care is expensive. In IBR, in CBR, it is cheap. In services, medical services, and here in community medicine, there are holistic services which are provided. So this is the model for community based uh, rehabilitation. So it takes into account the health for promotion, prevention, medical care, rehabilitation, assisted device produces. So when as a medical people, we only think about this part, not about there's a whole gamut of environment which needs to be thought when we are doing a community-based rehabilitation. So the education part needs to also be taken care of. The livelihood, the skill development and self-employment for these people, the social personal assistance, culture, humanic, economic support also for some time that needs to be also be given, empowerment, advocacy, communication, community mobilization, participation of such people, use of self-help groups, and disabled people organizations will give uh, and make the environment much more enabling. The advantages of community-based programs are their home-based, less expensive, existing community responses and resources. They focus on quality rather than quantity. Multiple approaches can be based on the can be brought on by the community. But what are the limitations? The limitations are because of the field activity. Educated workers rarely go to the field and also find hard to communicate with low educated disabled people. That is the, the low social status to CBR worker. Frontline CBR worker is a low profile job, so nobody will take it up because it is not a low profile job. It's not. It's one of the lowly paid jobs. Nobody will take it. Lack of community ownership because of the breakdown of the traditional social structure contributes to severe problems. And expensive approach as focus on the quality of a few hardcore. So it is not our abilities that count, but it is the abilities that count. Is what is the take home message from this lecture. So this was very short about disabilities or people with disabilities. You should not call it disabilities now. It's called a differential abled. And I'll be asking you the question that what is disability called in the assessment. Okay. Thank you for listening. We'll be posting the assessment soon on 25th. I'll be posting the assessment at 11 o'clock only. Okay. Thank you.